everybody, it's Dr. Irini here at Homegrown Chiropractic and Wellness Center. Today I want to talk to you about TMJ and jaw issues. One of the big things that I think brought it to my attention is mask wearing. I find that a lot of patients have been asking lately for us to work on their jaws. I find myself, while I'm wearing my mask, just kind of opening my mouth, just kind of dropping my jaw down, or pushing my jaw forward, kind of pulling the mask off my face. It's great, but it's not. I'm calling this mask jaw because a lot of issues are coming from the muscles. So let's talk about the anatomy first of TMJ. So what is TMJ? First of all, I'm gonna use my buddy Dexter here to help us out. It's your temporal mandibular joint, so TMJ. The temporal bone, where it articulates with the mandible, which is your jawbone, is right here, okay? There's a little tiny disc that actually sits right in there. So when you open and close your mouth, your jaw drops down and slides forward slightly, okay? When that's misaligned, there's you can get a lot of pain in that area. So not only is your jaw not opening straight, it's deviating, okay? That's causing a lot of issues. What else is right there? Your eustachian tube. So if you think of ear pain, a lot of patients report ear pain with that as well. So again, TMJ, temporal mandibular, okay? So it should just open straight up and down. Sometimes it goes off to the side. And then you're feeling crunching. You don't necessarily have to have the popping sensation for you to actually have TMJ dysfunction. It is something that's associated with it though. So what can we do? Well, the other thing that we look at first is to make sure that it's the joints rather than just, it's not just the joints and it's the muscles. There's lots of balance with it all. So up here, actually where this spring is, kind of shows where your temporalis muscle is. Comes right up here. So that, when I'm doing a jaw treatment, I'm often doing that on people, stripping that muscle, if you will, because it's very ropey. You can actually put your fingers up there now and feel kind of little ropes when you open your mouth. Okay? So right in that area, that's your temporalis muscle. Most people only focus on the masseter muscle, which are these muscles. When you squeeze, you can get trigger points in the muscles here around your jaw that open and close, and you can also get trigger points up here. Those, guess what, can lead to headaches. So not only are you getting headaches from here in the jaw, but you're getting them up here, so you're getting these frontal headaches. Some things that you can do some trigger point releases right here. It's not very comfortable, but it really does help. Something that you can do at home. Just kind of gently go down your jaw and find where there's a little tender spot. With that, you're just gonna hold it. That's easiest one you can do on masseter. Sometimes when I'll do it, I'll feel it in my head. Another thing, you can put your thumbs here. As you're opening your jaw, you just kind of pull up. If those things aren't helping, we also do adjustments on the jaw, which it's just like anything else. Like I said, there can be a little misalignment, so we just kind of do a gentle adjustment on that. We also do laser treatment. Laser is amazing. That you don't know about our laser therapy, I can do a video on laser sometime, but we also will laser in there, get that joint all nice and loose, and then the muscles up here and here. So we do that, tie it in with stretching the muscles, and then have you do different exercises at home. The easiest one is to stick your tongue at behind your front two teeth, and you're just gonna push forward. It looks weird, but it's kind of like tongue push-ups, if you will. But you're getting your jaw to go straight, and rather than one side opening before the other. Things that are easy to, you can do that at a stoplight. That's really easy to do. So again, TMJ, temporal mandibular joint, your masseter muscles right here. your temporalis muscles right here. We can, your eustachian tube also, so that's the ear, the tube that goes in from your ear, that also can get affected. So we'll do a eustachian tube release. And I also have a lot of patients who grind their teeth, so that helps with that. So anything like that, let us know if we can help you. Come on in. I know it's hard with masks, but we are very sanitary here and we're constantly cleaning. So, all right. See you guys next week. Thanks for tuning in.